Mame and now as watche amaya kwa Adekye Nsroma no ani gu so wo hwe bredu so ye mpuni mpu ye ba be bo enkomo nim se du fie da sei dia na eni jesem ne se obepie mu abe Fontaine Times UTV Ghana ye stream live ho no mo saso no channel 360 on DSTV so ye wo nti kame ho na ye nyina ye mo nkomo ne komo na ye ba bo ne de me se wo bisa media make say very sensitive a wo bie hia enti baby a wo bia ka che wunua na abe Fontaine Times obetimi Edward Dwenche no so afa ho no bibi ne a mebisa enso edi amaw ene yensa ka the ever gorgeous hey was a ho fe munyina Pro Max ushi ana no wo se woni hey when you ka se tuntum se wiwo ankasa we be ka say habana na wo de say e ba betwa no wo ka se me kae madam obi ada kopoko administrator Ghana Medical Trust Fund adodo na nim se fe no Mahama Case ono ena ye ne ba betwe nkomo mpuni mpuso oba pa me mo ache
menjoso abana
bibi obo hotie
me chia wo ne wa hwefos
ahwefo joso omo so ye rabadodo
ninja ye kakra
obi se wo ye raba ma fe de na tinso
abros wana oh we ye de we ya de nyamisha I am enjoying you nti koso ye no sa
me da se me am friend so me ka se me kan fo de me kan fo 2 minutes ni nyanwie ene ye hwa me kai se o mampanyini that time I didn't see ekunya so no de na ni so ade ho niema no oba even prior to say na obenya tumi in a crampo no oba ye niema wo share bo ka se obeye no ode niema ni bigu akwan mu na eni so ade hu kese pa no so ba ma ye di nkonkomo bebre even guest the banner discussion na yete Mahama Case obi so o mampanyini so when the banner say ni there in a flagship program or person or dey ejini din ebinom se dey bia pomodin asem ade a ye de gidin na emom bia wado asukwa hu se omanfo dodo na ehuna mane enti esi etimi eye special program bia ye betimi dia agi wo mu efri mu ene won hwe bani ye de obi ye project obi picture UTV has we na bi mu tie mu frɛ ye papa despite oh doctor ose kwa me bra na be ye moa obi enya cancer obi enya kidney failure obi enya cardiovascular diseases se akoma ehun yare putupuru ye se obi enya cardiac arrest sa eniema na na se eno na Mahama Case di na ni esi ho no ma hwe sa omanfo no eno obi ebo hwemegu ma so ti abana bisa madam obi ase enye bia omampanyin na kasa personally ni hu ni pe bia go through such challenge na enu nti na za de esi na kuma so ana se den esi na ni so pese wo ya na nti na wo hey de mama fe no ne nsa ase
oboni o kasa bia o kan say he who feels it knows it been told that o kasa keke but se bia told that wonim se ne etie se be say o share launch of the trust fund na omampeni ma omoye o UGMC ono ankasa kokko kasa ye na o de to amanfo enem so ono ankasa ne bi ben na ekun sa nkrofo no nti ono no eba no non communicable disease on fendi agro o se ne stepmother no ohwe no ne ye very close no we of breast cancer and now he knows the difficulty she went through before our day sabi o se ne papa bi o ye na edwuma no onya kidney disease or dialysis torn ho niam nya they say or try say or they call dialysis or they san ho yare but eventually he died owu ye no na che ne busuafo no kra aye basa because ne niam kra o wan ka say bi obejama ne busuafo kra na waye den waton sa niam nya de ahwe ne ho and that's the reality that you face when you are diagnosed with a non-communicable disease. Inti obiti baby or say other than health insurance wo na ya kwa kofa bibia ba your friend Ghana Medical Trust Fund. And Mahama side ni dia to so nti Mahama kofi o de beko.
What they say?
Was it Mahama de kwen? Said the kind of lives the trust fund will save, it's beyond your imagination. And now within 6 months he crack a kriya Obia shows na nkrofo isa na omo ba be ya na minim se san komoni nya na ye bebo but I'm just saying say non-communicable disease it contributed to 45% of deaths in this country. Ipe wu krum ha research near there, I bet you say 45% of those deaths is attributed to non-communicable disease. So it's not bibia. Utumikata we need feel the politics as usual. No, it's not possible. Intenya about healthcare ni dia. Bidia me pese ye jina abonten wana ye ja politics no ho. Because it can happen to you, it can happen to unu be or sister be or auntie be or papa be eda baby ultimately ena say ye the initiative be ba e betimi aboa nipa no through diagnosis through treatment or that fund no so as long as or tewa it takes some burden of you because nipa ni bi wo ho a omo best start so omo treat omo dialysis treatment ni ade go through no omo wo kakra omo de beye e bedum finfin no mesra wo ne ho hiahia no o twe antwe because one hwe yobeton ho ne ma nya ade asa ho yare
na sa se bia ne kokofo bi wo abeton no the treat ya na along the line be halfway na so koka obeda no wato so
thank you until at the end of the day nsisi ano wonim say a trust fund no ho wo doctor de wo to fund no so at least when your respite be wo ho wonim say we japade kakra bia sebi ho kan obusuafo de be hwe omo ho no omo nkoton mfa nye den emfa nhwe until we no yentimi nya no politics as usual because me na me trust fund hono umba mayenye intervention ma and our doctor mfa won to fund no so na yen kan che doctor and say doctor obi obeba beta wani ma wode na to ye fund no so no but modern bisa say ne party card we hin or ye NDC ni ana or ye MPP ni ana or ye CPP yentimi because we are looking after about over 1 million people when we roll out you be rolling out on the 1st of April and we know that all these people are doctors and interventions. We cannot go and do politics there. I think that for starters, no, yenyi politics ni fiso. Na yenhwe mboa ebe boa omai because at the end of the day, yebeye mmankrofo nya ho mfaso. And already nankasa pilot cases bi aye no yedu ho ayebeka ho asem. Nkrofo start kasa dada because he has saved lives.
Me kwana ka me baba bebisa say were you overwhelmed? Must say a pilot no nipa nkofo omo ba ye na you be on my automatically no ube interact with the person na wash nipa ne background ne nipa no we need that so become say nkamwe bi sa betimi aba emputupura na say ayare sa and ayare sha wonya na nko benya ne sa
mama ka se mche midwife bi na im say mo sister station bi ye yi say be oje awo na something happened in her head automatically she went off automatically no mo de to ho say omo hia mboa e de aboa no and then obehia kadlaba ye de be ye ni procedure because ordinarily for such cases in ka ye be open head surgery omo de ne call kolebu kadlaba si ho no eja to munti enye adwuma inti government facilities ni nya ye nya kadlaba man nya den enye midwife hu adwuma nyame ncha de hospital private one your friend Urake no mo ko lebu for no refer no call oduwa omo se omo betimi aye but say na ye beje no mo de to abontin says 210,000 ye kofa bi wahi thank you no mo de to abontin madam sorry am hu am see case we ye be na ye call Urake for no ye call ye payment ma me no at the end of the day the next day Dr. Sako de any team no omo ye procedure no omo connect ade na it is straw cord bi omo connect to utrima baby a wo cloth no whatever it is no ma twen pie eno I'm telling you that within 3 days she was back on her feet and then okofi sani pano nkada ben ye ba ba gigi contribution amano da ben no okwa ni treatment na nka wakofi then put na che osesa scan nka obenya de akoye meanwhile maame no ye koye na ye kwa akoye sa donation na ma no enye ne yare na odwin hu ne mba na okoje omo awo no eno na odwin ho se mesra mo nje me na me nkohwe mba iwe na me nkoje me baby si me nkoje awo. She's thinking about her profession and what she wants to do for the women in her community. She's not thinking about onwa when your brain aneurysm here. She say nitina e dududu ne siniti so ye no hwe enye yiu. Into obisano, if you save that kind of person, you have made an impact on society because of the blessing she is on the people in the community. And then, ufrena nenia je yada sinyame hira we nya wanka meninkwa. Nti we obeka say ye bibia anka say ye jama health insurance ko ye ne ade. Meanwhile health insurance ejuma ayefo. Ejuma omo ye ne omo claims omo ye ne de bia omo aye busy onboarding crofo etua omo claims to the hospitals ejuma omo ye. Rebecca na da so no. Oh. What am I saying? Nti wo be den na waka say we nka ni say yeti Edema Ghana Medical Trust Fund nanka say ye dini nya aka ho Emma health insurance. Health insurance is already overwhelmed. Ubay then now the account. Abna your mandate no a 4 core mandates. It's not only about paying medical bills. Medical bills, yes. Medical bills is just one bit of it. Secondly, you need to be sure say infrastructure and equipment are available to treat the chronic diseases. No,
to provide it no.
Thank you.
Because people say a Ghana Medical Trust Fund for a solicited fund or more calling on other institutions say or more meboa. Into ya reading sika. It will be donated ya reading sika na. It will be what say hey. Yes, Parliament are passing 2.9 billion ama Mahama cares for just a baby. Obi say any mama say hey the money is big go. Hey Ghana. I'm telling you, you why investing in the equipment now? You cannot treat the persons living with the non-communicable diseases, no, because no, you hear CT scan, brain, na ya say be a clot, be or BB. There's an MRI, there's a fluoroscopy, there's X-ray. In yama be brave. Into our equipment, no, say facilities no lack here. How are you going to treat these patients? Who to me, sorry, will bill when you don't know how the person is going to get the diagnosis and even go further for the treatment because there are no equipment to treat them. What am I saying? Into your starting and your friend needs assessment tour. We taught the facilities are 10 regional hospitals, 5 teaching hospitals, and they started and no my equipment gap. And no data for persons living with non-communicable disease or treaty or various facilities. No. Inti sa gaps ni nya no sesi ya pile report no and only a Bible ya denam inti ya kwa ya fa act no na ya fa non needs assessment tour report no na ya denam because no train what the gaps are. Oh. And na so yentimi ma hospital bia keke enye entry to your patient because when you do chronic state now as a regional hospital and a teaching hospital some of the district hospitals will rely on because on more communities there are no regional hospitals or teaching hospitals until we just have to upgrade them kakra and for equipment kakra binsi wo ama yetimi refer your patients ni bia eden amomo until ninyana is part of the equipment and infrastructure and that's the second one. The third one is investing in specialist training of our doctors, nurses, pharmacists, and healthcare workers, no, because some chronic states now they need specialized care. It is a when trainee doctors no more. It be home, but I see a training become and some of the regions lack these specialists. And as our specialists way, so we need nephrologists or facility be cancer patient to do one why na be no. And a nephrologist doctor nankasa so unya as unya nurse so ono so you trained in nephrology. Until at the end of the day, you hear specialist doctors, specialist nurses, healthcare for trained in those specialties, so they can work on these patients. And that's the third one. The fourth one is investing in research for non-communicable diseases. So one year researcher, who better than who say be in this community, maybe in the eastern region, in this village, and in this community, cancers be a dose, and it's the same trend. One year research now, who better who say a whole problem ni fever, into your bed who say you solve it, and I say you acquire better so at the preventive when be alcohol. And it is not just even so nipane drew end stage and I say be or what no. but rather the root cause
of it. Yes. And
I understand because I'm more eradicating.
Thank you very
gradually,
much. Gradually, mandate no for no. And ye bibi a ye didi a grow bi wo ho na adwene say ya sese sika ma trust fund for ye say ade chia omuntu ayare for nya sika pa. Kotua ombeda ko treatment. The conversation is not just about say abnati ye ne ya ko hospital. Yes, abnati ye ne ya ye betua. No. It's way beyond that. Inti say obiti baby na say na adwene say President Mahama and NDC for person omo titi sika na omo ati sika fi National Health Insurance omo de koku baby so obi ankota nkodi. No, it's beyond that. Way beyond that.
Okay. Now yen hwe kwan a enkofo ebefa enrolli wo ewo this special so
the whole healthcare mandate no Oshe President Mahama wisdom na why say pyramid asie ho no enche bia or the free primary healthcare no obe launch free primary healthcare na that's the base and only patch us sorry anopa chips compound we area nurse midwife bia we be small clinic bi wo ho ne ade ubetimi aboerua ho I check your pressure. I check your sugar. However you feel, who to no, or what I was starting. When you do what now test you yes no, we sugar the say I was stroke cranty. You need the next level now. No more the what to National Health Insurance, and so that's when you register for the National Health Insurance card. Into your National Health Insurance, not damn fin only any penny, but or damn fin because on no be take care when you are referred from the CHIPS compound in a hospital in clinics in kitten any idea baby primary healthcare fund be set up beer. Into when you are enrolling on the National Health Insurance now, obviously that means you have a National Health Insurance card. Yes, into National Health Insurance you show to a certain level the mandate na cover. Ordinarily nka hono nanka yejawa ma webusuanfo ne wankasa say go and help yourself. Yes. Thank you. Because health insurance in duo and the dialysis health insurance or 2 times a week. So even if you need 3, 4 now, a extra cost for yourself. What's my say? And then
quite and see wow one more end stage no me they say all dialysis ni the other injection a no be so better to and only the
yes and in the wisdom of His Excellency the President of the Republic of Ghana John Dramani Mahama or say who we National Health Insurance na yenja so from National Health Insurance you move straight on top Ghana Medical Trust Fund. That is the chronic state no. Thank you.
Burden of
on National Health Insurance. Because National Health Insurance, where it ends, no, that's when the Ghana Medical Trust Funds begin. It is a UTA interviews ni baby ni kasana ya menama bontina mekana. Me see where the National Health Insurance ends, the Ghana Medical Trust Fund begins. Into dialysis me no. Any niyama kakra ebe yama ebi awundro kakra no o ende wo hwa wo doctor na ohwe wo no that's the medical doctor no onim se wo National Health Insurance card onim se wo ye Ghana ni we are eligible to fund no conditions are ye cover ono no do beto fund no eso inti se wo doctor ne me na se mahwewa through ibia wo start ye wo sugar call soro ye say ya wo dialysis ni ade we hu say ibia akosoro we hu say ibia affect your kidneys we hear surgery and now we hear going forward you need some extra a year ono no betna ne machine enim na Ghana Medical Trust Fund bottom na wo ho no wa press na wa upload medical records no now my reason why you need to be onboarded onto the Ghana Medical Trust Fund. Into who as an individual no you cannot walk to us as a fund to say me yare monfamento fund no it's not possible. It is your doctor in the tertiary hospital no. And when I talk about the tertiary hospital, I mean the regional hospitals and the teaching hospitals. Any other private hospitals are omo equipments are we mu ni bi no until we will onboard them. Ye ni omo be kasa na ya onboard ye omo kan ye de no ho na ye ni omo aye adwuma. Otima say nti wo fa no Bank Hospital, UGMC, Maritime Hospital, all a few of the private omo ye be 6. They are starting your omo din komo. Say ye roll out on the 1st of April now. You per se you know more can list no because so far no for districts no regional teaching you know we will have about 21. Into you per se you do more count you be roll out na kita be 30 facilities. We doctor across board across the country. Into o doctor now or the wo to so no send ho no equipment ni bi ni ho na o de wo to ye fund no so na ye approve say ye be accept wo fund no so but o ho no ye nya sa equipment ni bi nya wo treatment na we can refer you enu ti na nurse Rebecca okọ kolebu for sick ye card lab na nya ejuma nti ye refer na call urake no more refer no Inti that one is accepted on the fund.
Okay, inti se ano metia was mo start here for instance se kolebu no mo ni machine ni bi no mo start mo beto machine ni bi di ama wo.
Inti se ano inye se ye start crowd ye the machine ni bi si ho. Inti enchem memo mo show pictures no. Kolebu de na ahye no. His Excellency si ye to miensa. Miensa no ya to dada ye de ba. And I'm quite so. Wow. But what is going to happen, let's say, or the balcony see kolebu, or more than she and ye to two if you only had the 4 9 day, esi ho. Ye the balcony is see confanoche, nay the balcony see tamale. Into your mom tamale in the surrounding communities near Denia, they can use the tamale one. Or more Ashanti region, communities, constituencies, no more area when ya him say see I be a ba confanoche, metimiako confanoche, and kolebu will be back into full operation into Greater Accra for any surroundings ninya so be dey betimi akokolebu nti kolebu ni machine no say afede ye tutu oti ase into by end of March na ye installing new one no omo ho ni so akakra into what we are doing is that we are doing some expansion works near there ye we are na ye the machine na ye dey esim
ni nyina kamo
thank you very much into I know na mijuna ho ye ho eju kolebu doctors any engineers near there Inti from January na ye start here. Inti ye hope say by January March ending no by 31st no na kolebu is in. Inti kolebu no beshawa. That means that we will move a lot of the load into private because private so no so no problems do so the electricity near dem na no boy dey. Inti me fan say private na je obe 210,000 to say na you ma Rebecca na e bia kolebu betimi age we mu half.
Yeah.
And that is what the Ghana Medical Trust Fund is about. What am I saying? You call confanoche. Building, there's no space there. Thank you very much. You see a whole new building
for that.
Yes, you see we do yes. Into year 2 for my year foundation, and the building is going to go up by August. The building is up. There are theaters in there, the card lab is there, consulting rooms, oxygen plants, ICU, hybrid theaters. And what do you, yes, Ghana Medical Trust Fund Cardiology Center, everything you need so far as cardio is concerned is in there. When you're way in Siwa, or more cardio related issues, how are we going to treat them? I just need a lot more people to read what the act is about and not simply sit down and say that this monkonko tia yarefo bills na monam na modi ye see why ye intimi treat patients no. We can do it to a certain point, but we cannot do it to the maximum a bit may save lives.
Wow.
And then Dr. Sako Urake within how many hours will be so on any team now? Omodi adiane pass it through ma military mu call bloody whatever the cloth near adiane fiho. The next day she was on her feet walking. Ordinarily in ye be open head surgery. Ye be utrima 3 days over to yes. So these interventions are not one that can be trivialized.
I see. We say obi share na say so obi person obi donate not just bills no e bi ne say confanoche
and na me person me sure say until last year no ye buy no ye mandate na wom say ye betimi appeal to corporate institutions individuals near they no mboayen until near me here and say I went out and begged for people to help us in between September and December fundraising na mitimi here 6.6 million Ghana cedis. And no one and the year you see a 50 pilot cases to test the system and know what we will be about when we roll out. and the 50 pilot cases no eno na Rebecca Dienya your friend say na yarisa 5-month-old baby a wenya glaucoma ye wo no yes and then ne bia ohwa ade.
Wow, out of the pilots
yes.
No.
Into pilot cases na ye no. So fundraising we na ye GG ye no. And no na so far we've done about 35 cases as of today. And 35 cases and it has cost us 2.85 million Ghana cedis.
Me sa ba wo so abusuafo se wo share wo kasafoni na ni a flyer na eda honom no kire wo do *255# na all network no nti kakra wo benya no na wayi edia support, to be honest me hu adwiri me papa dine ya kana say ade bi wo no ma say wunnimu a you know what's a hon ma beka de e wo de but say wutimi enyam nkyire mu yie pa de a wo betimi ate ase yie na wo kan so wo hu de wo kafa because yet edin oh you know the popular slogan Mahama cares oh
Mahama Kofi o de beko
and okay do enti wo share eyi na kasafoni na nti wo follow direction na wo honum ni nyina wo so kakra wo be yi na seketu bia ensa ketu bia ensa na me de ade a emu yapa na se wo hu nipa bi ebenya cancer very expensive minimum bi asabia me ne wo kasei wo India emu aye din ye pa de amana ya sresika sra but ekwan na nka wo de a wo se ekwan yi tene nti mesre we de na ye nyam adesua pa yi de mama ye nya hwe na yenya wo pepa si ebeyi bi de aboa nti se wo hwe wo kasafoni nani a de da honom ni nyina no follow a menim si ebewie no ye de number betudwa na wo pese wo fe meka se bia wo de na ese kutu se bam we bu a wo betimi ayi de aboa
abna sa nipa na wo India no onya ko obi opese ye boa no onya ko out of these borders we don't help that person.
Oh sir.
Yes. Because when you go beyond na $60,000, $40,000 and sa sikano Ghana Medical Trust Fund for you cry you betimi dey nipa 20 into across the country. That's where we belong.
Because of how almost as equip
facilities. And that's why that's why we need to equip the facilities so that when you cancer won't you plane ticket in kwa brochiro we should share hospital you betimi aye treatment because we do ono na equipment ni bi wo ho ma me nche equipment ga ba ye wo kroma unim said October bia kroma baby ya branding a pink me sure some kroma until mo the pink see wo me bo ana oko teaching hospitals here ma bobosui any regional hospitals here the whole of the country mammogram machines various facilities F5
Ghana
inti ende woti we wo sorry now say me default me pese me check menufu inti me call Rich Hospital obedu a Rich Hospital mammogram machine be nsi wo and that is the capital city's regional hospital. Unim Rich Hospital up to 800 patients 800 to 1,000 patients a day. Some patients when you are walking into the facility na se doctor nika say wo hia CT scan wo hia MRI and now wo hia fluoroscopy obetro chitama na wako outside the facility to go and get it done. Now what we are what the results na heading abreno and then corporate institutions work room omo workers nenam bibi tono so sesia ya be kukuru na Rich Hospital ya be catch us machine ni wa ya de be test and until na yes corporate institutions since omo nya den omo boa yen with their CSR budgets ni bi na yemfa equip a place like the Rich Hospital because Kolebu is taking care of over 2,000 patients a day. Inti say to me equip Rich Hospital na take load ni be free from Kolebu na sa private institutions so ye de omo kan yen Eurocare maritime foi omo be kan yen ho a wo yare wo be fa plane akwa abrochi dabi but no mo ntiase so they simply think that oh we dey ye disika ko si baby na ye no. And at this time, so yeah, cultural equipment and yeah, to various facilities. No, we are not just dumping it in the hospitals. We are taking care of them. It is a Ghana Medical Trust Fund. The equipment could see Raja. You need also the servicing time, the turnaround time. Ni bibia ye na ye be manage. Into ye in Jama hospitals no as usual. What am I saying? Obi was say, oh, the last time your corporate institution wait come out hospital and check 2 years, 3 years, yes, I say no, this time is not like that again because of the Ghana Medical Trust Fund.
Info be na say wooden door be beginning. No, the other one and sana ni say you know. I think so. Saying a net and more transform here.
That be and transform here. So these are the pictures we have for the various facilities.
Okay,
when you dey kwaye yeduma. Nti ye fa
to more transform here saying
thank you. Nti wonim say ye needs assessment or document na ye kran. Ye nim say kolebu say ye dey omo MRI ba kon ho. Say ye dey another one count because of the load there. Ye nim say Ridge Hospital dey shini ho. Nti ye nim say Ridge here CT scan ba kon MRI ba kon. Nti ye Bible na ye kra for the yes. Ye nim hospital bia ye ne be ye adwuma ye nim new here. Even some of the private quasi hospitals no UGMC say nyama bi wo ho omo here say ye timi de bo omo no omo boa ye na ye hwe ye patients so ye nim say Maritime Hospital omo so say ye bo omo e bia say be uracard ogina na so on do here hwe nti on de oni ye be ye agreement say be nka nipa na nante ba ha meje no one Ghana but so for medical trust fund so ba e bia meje na 80 pesos nti as agreement thank you. So we want them to meet us halfway. Now you know your list of facilities, no.
Hey, but that's a lot of work, because I will share all the year now more transform the abase. I mean, some medical equipment and so they are very expensive.
Yes. Until what now say yes, here more budget 2.90 almost rema dey me more. What trust fund.
That's I'm looking at it. It's now no more. Number of people be a mobile a year.
So what we are doing is that conditions yes you. But what we want to do is that because we are now starting and the software is new, no, doing say cancers no, and no a problem until we want to roll out from the 1st of April no with the cancers, prostate. Breast cancer, cervical cancer. Yenim se nkwala cancers no so high. When we went around 4 childhood cancers no, we share data na serious. Into what we want to do is that we are rolling out to the 4 childhood cancers, then the breast cancers, cervical, prostate and all. Until we roll out with the cancers. Until you roll out with the cancers now, if you are a cancer patient, let your medical doctor put you on the fund, and by that time na software no you're connected to these 30 facilities I'm talking about. Into we call hospital na say onu betimi treatment na obe on board on to me ya obe refer to one of these medical facilities na under us no, then you can go there, then they will deal with us directly.
Okay,
what you say
me fane se bia to say the okay tamale bia nipa be say for instance 30 and was any of the cancers no nebia out of 20 there or more bibi or mobetimi and nebi o marefe bia for instance confanoche se nipa ni free ho no maba confanoche no na bia or baby or beda ni nyina covered and na say
ninya covered because and that's why we are trying need public partnership for more person almost setting up diagnostic centers near the end. We are opening the doors for them to set up in the various facilities for us. But beginning na it's all our cost because we need to transport you, and the chroma radiology machine cry per radiation me kase ye 1.5 half nature se kolebudi no sometimes be 2 months na break it down ye hwehwe party intime fix here lie wo ho be wo betimi ada so be 1 to 2 months na endu so ma wonko ye radio therapy treatment no and na outside private for no ye won good one wo ho inti kolebudi en delay yen e se ye de private go to awarding. Into what we are trying to do, say catheterization labs now. We want to set up oncology centers in the various zones now. Ye zoning microphone taking advantage of and also no, it will have all these PET scans for cancer treatment near the end. Would Tamale Teaching Hospital, there's an oncology center, there's a cardiology center. Into both ways, no, you can access any of it. Into your basic vantage points in the country. inti ama se ofi savannah ehia se obeba akra oko Tamale teaching hospital yeah okay
and boy you know fit Tamale na oba ekofa no Sunyane Sunyane teaching hospital
inti Sunyane eka ho yes Sunyane is on our list
inti yeah kasa say be producer say woman be a first mo sini kuno e da dialysis so na okoje treatment on the machine be all right but on say I hu popoye na ade na ekeka ho ne de inti mo beba be ye bi wo no mo
of course inti Sunyane any area ni areas ni nya it will be in Sunyane teaching hospital Okohoa between the teaching hospital is in Ho and then there's Hohoi also we want to see because of no distance no mu wakakra inti I don't know ye hu adwuma hu how it will be helpful to omo sa zone no mu wokota kradia efiankwanta hospital eno na yebe you see for starters no into omo wo na say galamsey issues ni ade nti wo hu se sa yarea wa na ni ade na doso e wo ho o greater Accra de wo ba at least eno no de yebe nya more than 5 facilities because we are trying to retool Rich Hospital with the corporate institutions no Kolebu kakro hia no eno ne kadla bi ni ade ya ye e wo ho nti Kolebu Rich Hospital na ye the Uracare ni Maritime Hospital ni UGM ne your friends a bank hospital near ade no akanye ho eno no Accra de ubenya a lot of the facilities but baby a ho ye tro kakra ne de ye wi a ye de beto abonti se Sunyane for any surrounding for monko Sunyane teaching hospital yes
inti ade am be provide because nipa na ye o kan so say other infectious diseases bi o said bibisa no so na equipment no e bi ni won say munya setting about mo beto sa na
nya nkakra ye ntimi nton at once inti wo ba ye equipment list no kra thank you wo ba ye equipment list no kra ye grade no first phase second phase inti ba ko beginning no de no ya cho urgent needs
okay the here na
nimu he ya ma yetimi roll out ma ye ho ayeden enti at the end of the day na ejuma ne de ye be you but e ya botre one step at a time enya jina within a year going into a year and a half 2 years no one kasa obeka say nyamisha president Mahama that initiative can only be celebrated because untimi condemn and the 35 people have been saved just like that. Ordinarily, they wouldn't have known, say, Bibi Sabetimi Ajemenkwa. Bibi the Omudian Nancy for several months. And then, we call cardio center or Kolibua. We have paid for 10 children to go through whole in heart surgeries. Yes.
Wow.
How are you able to trivialize that? No, to me.
And I will so say obi ekwama no ne so kwa treatment ene de muntimi emboa yen hwe de bi a wakọ India na sese no waba Ghana mo hyase no waba Ghana say okay opeso oba beji treatment no wo Ghana ono so
here ne say hospitals na ye ka ho asem no teaching hospitals regional hospitals make sure you get a doctor there otimasinti
sorry edina mutu aye no who we say no ho check na my present
fiankwanta
wow
into hospitals ni nya brain patients a omoda hwa bi omuntimi nti omo bill bi mo ho mo hia surgery but omo nya surgeries ne mo because omuntimi ntia into ye keka bomu into wo hwa in all no ya 11 regions 11 regions have benefited from the 35 you know your friend is saying pilot cases and so far ka 15 per year na ya end of February we no na ya end the pilot cases no and no ya 50 per. After that, then we concentrate on your software connection to the various facilities. So now, launching on the 1st of April rollout. The facilities can start onboarding the patients. But obi awako treatment wa broche na sebe anye ye na waba ibio nisika asa wo na onye hianso obehwehwe hospital eye under us inti regional hospital Kolebu Rage Hospital Accra uko IMAC Uracare money idea then you start from there. Okay. And so they are the ones who ask us say me patient to see request number yen ho so investigations what must say and then within 14 days
to avoid conflict of interest
until within 14 days and we approve or disapprove when we disapprove that means that we are looking for further and better particulars until no say obe chechim kakra be a document be one fan kan ho ne ade now we produce it then we onboard you.
Because come papa pista say be dey no who say nipa yare na ode ba na no kremu ene dey obese
yeah we doctors a team my ne omo ye adwuma from subject matter experts into depending on the subject na what they beba no omo na ye di hye omo nsa mo investigate hu say request we no edem trudo ye wie so a ye wo nkrofo be from patient navigators. We are employing them across the regions. Sunyani Teaching Hospital will put a patient navigator there. Okay. Our Juma for the Ghana Medical Trust Fund. Thank you. Yeah, on board as a patient. He is the one who will make sure say we treatment in will go through it. So Adekye now your friend is saying CT scan appointment. Now about 10 now one by patient navigator na say obefrew
so brochina baga no
ofia obedi wechi aba ofia behwe say and the one ba treatment then na wamba
really
yes and na wo facilities ho so a ubisa say Ghana Medical Trust Fund for no omo office wo facilities no be chere say bia omo nipa no ne dex ni na wakoho and then you can go and do a follow up. Into each region has a patient navigator, and then these regions na yeah for munya these 30 facilities will zone them into 5 zones. Into zone bias one zonal head.
Wow. Yes, mama.
We have arrived.
Papa. Enti obi kan obeka say you will be to treatment in a so more a time frame more expect say be any pan ho beto na free so na say mumma ample time say on go through the process na ne ho to no so be obeka say sikasem tintin do Mr. Mu de munya ne ntem na yenyi ni pass machine free so say the be others na so be any opportunity no so
say oda dialysis as well. The what can save you is a transplant because and yes you will be on it for a longer period. Into what we are even trying to do as we roll out the cancers no cardiovascular for near and we are looking at the fact that near ebema say ebia say wo no dialysis what does for all these years na yenim say be a transplant na beboa then the subject matter experts no will advise your technical committee for no advise says anipa we maybe what we should do is to negotiate for a transplant because onya transplant no pay thank you very much na kana ye bo won ho na eden etweka Inti is a whole team that is not sleeping and cracking their brains to do this.
Yes, see one of them say ban says obenya transplanter. Ghana Medical Trust Fund for EBBM.
We of course. So far as you are with us, no, we have to take care of it. Inti so we will talk to these facilities and see how they can come to a middle ground with us, so that yenim say dialysis ne do so. If you are saying say ye we man na sa we recover ebeboa ye coffers na. Why not? Wow. It is a whole huge and bold initiative. It cannot be trivialized. No.
I see. And now, the share a age, you know, who boss I can say and childhood, cancers. Until obia I be registered say and found any age, more general.
Yes. Yes. Well, because what was say, I'm telling you that say you Rollout cry and you obi no person or access yen obi wo ho no abetimi etua nti omo hu hia omo na doctors ne hu say we de enko hia mboa na ode ne beto so nti you roll it out mum but I am sure say doctors and those who are really in need no omo de omo beto so but obi wo ho bia ono abetimi cover at least for a certain period till say bia na hu be hia na obi decide say mesra mom fa me ento so nti I'm not sure it will be that loaded as we roll out but going forward I'm sure that be cover enkrofo bebre
okay now wo so na yes start bia de wo atoso na along the line no bia nipa no hwe na o pese wo kọ amanone a enu betime release ni pa na
betime release and board de na ye de away
so okay
yes because the moment you decide to go out of the borders I know we are minua we are me wofa we are President Mahama whoever you are you don't qualify to be under the trust fund.
Okay. No. And before so abeba so no so na say wo NHIS
card, and then you have to be a Ghanaian. And then you have to be accessing a condition that is covered by us.
Okay.
You say you starting now, you say for the next 3 months, yeah, cancers no. Unti me bank I say be when you stroke into yemfa that be. But if after quarter no, yeah, I didn't you see the stroke patients na kan you know that as a stroke patient you can come. Into by the end of the year, now you on body a lot of the conditions. You can see yeah ninya at once. Yeah, into me roll out from April, no, a bit slow and down until we want to do it in phases.
Okay.
Yeah, cancers. You say after cancer 3 months into 4 months, yeah, the stroke account into 5 months. You say yeah, the cardiovascular disease account. Na kwa ane say yeah ko. Yes.
Nti any phase biano, the amount of Baba can the rules.
Of course. Into yeah, rolling out, you will announce there will be a be a mefrem onto a soiree media for a kukudam for. Now announce what the rollout will be, what it entails near there. Into area, you better abon de roll abontimo being with the Ghana Medical Trust Fund for starting. But for the next EBSA, no, you deal with these conditions for childhood cancers, prostate, cervical, breast, kidney, then after that, no, we will get into the next quarter now, BB. Then we come out again and say that now we have added stroke. Ultimately, just like national health insurance, who say every time they're adding conditions. That's exactly what we're going to do.
Okay. Shailu Bene Edia, but Madam Obi understands the role assigned to her, and she's performing perfectly. God bless her. It was when Shira no sinyame Eshra opa. Obi be bisa se sa yare obeka se yare mu akukudam. Yeah, Ghana Medical Trust Fund for to omo so say wo mo beboa ma omanfo enye omo ahoto no. Si ye sika na eye involved na, and even machines, equipment, infrastructure no na ade na. Sika na ekom. Budgets are ye trade mama oka so be say we bisa ma de ma fa mountain e wo sika bebre no. To pay me tia say no ne nema wa list no say endru baby a enye bia no e sustainable mo betimi ato so a akwawie ya na
Fanasa government so or the year ne pilot Fanasa so government is monitoring and looking at what we are doing. I'm sure say mid-year review wo next year budget wo omo hu senia ye adwuma no omo hu senia ye kona omo betumi decide say okay e bia sebi ye mo direct source of funding. Because now we depend on national health insurance budget. No, it be obeka say okay, me ye mo direct source of funding. I'm metimi ama omo mandate no baby is omo ye bi omo metimi aye. Inti government na nkasa no ade na we roll out no nkasa no or the ye ne pilot. What am I say? And then obviously we keep briefing them into onim say cardiology centers are going on. Onim say before you be rolling out no any equipment in kiti bi wo wa. Say ye tumi de mema various facilities and yes transportation in money ade no ebeye too much na inti government na nkasa no so or monitor inti embre be so a obeka say bia 20% of national health insurance any contributions are corporate funding more money ade bia enso inti yenhwe ne ayebetimi aya ombenya direct source of funding. It can come in any time, but for now no we are working with what we have and we will make it worthwhile because ye nim say ye no mu say aha ye pian bibisha ha ebeboa omaina they will do it. Intermediate, I'm operating as if that a pilot program for the Medical Trust Fund, you know, and I know that government is paying attention. President Mahama, fund be only one grow every 2 minutes. Be when original stage so I also talk about health. He's talking about the Ghana Medical Trust Fund. It is a legacy that he wants to live for the people, obey Ja'ama, the people of Ghana. Into only one grow, and every time, every step on the way, he needs updates. He's asking what will this be done? What is on one kasa stage? Super no come once a man. I say na me cry and I'm say na we why na catch it. Yes, so he's just every time you know or person who near kosu baby aye do what are we doing near denti menim say na koma da ho pa on di one grow.
Okay.
No.
And you know you encourage you know other institutions say omo embra no mo ameboa obi be bisa say so omo no mo papa support here more special package be at the mawo mo.
Exactly. Corporate institution be or your contribution to the Ghana Medical Trust Fund tax free. Yes, yenji tax. Also, until usika na utia mayen. Obi wasi me disika you come we me ameko kutia mo tax dabi tax free. And as equipment ni sa na na odi mayen through the Ministry of Health no ye be yi report free. Until yes over duty answer we yi their brain dabi. Just let us know what you say and then we'll take care of it.
Into machines here we can make us be aquaman on it. No what talk.
And one the Ministry of Health so be year my free na the CC hospitals so CC a group be on mobile chroma from Project Cure ni omo ye ne say omo equipment almost ship about third world countries ni countries here amboa into omo abase no omo ne doctor ba conductor no be kipo e call round to take the needs assessment no omo ankasa going around the various facilities and taking notes of what the facilities need. Sometimes almost send about 15-20 containers of hospital equipment, beds in man. Assessment no I'm sure they will send us all these containers. Chama facilities.
Wow.
Yes, but then they are giving it to us free of charge. What am I say? Yeah, well, Mercy ships. I don't know if you know about Mercy ships. Surgeries or ship or so no. So they are coming in July. Thank you. Partnership. When they dock now, they want to do about 10,000 surgeries. What I say? I need tumors in this area, man. You best transporting patients now more no my surgeries no, and they'll be here for 11 months. What I say? Telecell Foundation. My equipment I did testing for cervical cancer. Ya de ba kwesi sefio so ya de ba kwesi kolebu ya de ba kwesi tamale wo yo ba utumi buffer hoko ye wo test pap smear ne sa ne manya nyinya is under the trust fund. Individuals ne corporate institutions we have spoken to them last year no na towards the end of the year into no CSR budgets no asa this year most of them have assured us that for the first quarter no they will help us. Me see Rich Hospital we need to better tone na nya abansika na yede be retuli individuals corporate institutions beba mayako akoye we need to better tone na yaye nti I am of the view say corporate institutions, individuals who do not even want to be mentioned are the ones who will support the trust fund.
And then tax
there. Na make run am do because we nisika no.
Na yet share 100 nurses, 100 pharmacists any woman maka mo person mo training woman so mo maka hono.
Yes.
And no better ma select.
Yeah, started that.
Hey. Physicians
and Surgeons College. Professor Adanu Nedano. Nti yaye in talks with him. Now ya back into agreement say you perceive training 100 to start with. Or say 100 no omunya are cut across the facilities. You need to be in Puli omunya so omumbra school wa 3 years. Into what he's doing is that or setting up team mo back around into omo name say in the Volta region, you know, omo ye ho any they will train the people that the facilities give us, no. Omo name say Sunyani Teaching Hospital ye me and some wa na for omo be ye. Into by the time omo be we no na across the regions, no, ye nya sa 100 specialists, no. But then every region will have a specialist. What I say? Into what?
There.
Thank you very much. His Excellency say or person or sorry. Region Bia can boast of a nephrologist, cardiologist, your friends a critical care specialist. Into ye omube yes our training be each region can boast to say ye was our specialized doctors, nurses ne e for no ho. Into physicians and surgeons for no trainee doctors ne maya. Ye enche be able say assigning MOU no na ye payment no to them, then they will start the training. Ye any midwives and nurses and midwives college so akasa almost on be training 100 amay ye betia no my sa training you know ye ne pharmacists college for no so akasa almost so ye 100 amay what man say into what is going to happen is that is a partnership between us and the colleges. Because that is part of our mandate. We need to train specialists and share them across the country omo betimi ahwe sa critical conditions no amay
na specialist and after the training Mono mo be going into an agreement and
because bond dey dey you be born months yes, but then there's bonding and everything. It's an agreement that we will have with the facilities. And as our doctors and nurses and pharmacists near then you be training on munya me na me dey omo ba want me apply from me. Facilities na ye ni omo ye adwuma no omo na omo be yi say yenye ha ye pese we ni na ekoma yen nti bia ye beka say bia regional hospital bia ma yen nipa miensa teaching hospital bia ma yen nipa 5 na ya kan bom na ye de listen ama nti ye be we na facilities na ye ni omo ye adwuma every facility will benefit from this training.
This is I don't know what kind of the motivation of politics cry nye mo na hye mo nsa te say the kind no ya because oh because me party card the government because na nanka me ba be bisa say doctors mo na mo be select but what we be
obi ani ho baba me ho because me doctor ni nti hwe no nko training ni bia me metimi aka hwe because it's nipa no oni sa facility wa on qualify into medical directors ni CEOs no omo no mo be kire nipa omo pese omo de ne to so for their facility. Inti memembem otimase. Inti obi wo ha one ready act no na bia we ntie me say ndema betan me kase ya ona ma no kaka no basa.
And idea we bia so is backed by.
Thank you.
And right.
Inti makacho say me Bible sisi a emiensa. Nyame de no. Na me act no.
Only government trust fund act
no. Na me needs assessment report no.
Wow.
And no fa ne ahia say me ye bia me.
Na wo ye.
Yes. And abla me ntimi mba ha me sorry a me mbo me minister abaso. What? Abla minta kando.
Was it what?
Ejuma de wo ye na nipa otawichi no penny no se otawichi na nia wo beye bia no ono ankasa kra pia se ye mo a onya ahoden de ye kwabna minta kando bebi obi anyame nhira no oboa yen na de bi obebisa question we ekosi sen we ye ne sen we ekosi sen ma uru enfi we yo inti every time no he's on your tail inti ama de bia no open tema kwa because onim so oba bebisa question what man say minim so to kwan into okoye minim so oba pe obebisa me say kolebu den na esi wo ho konfanochi den na esi onti this week mako kolebu mako konfanochi meko tamale ne Monday Tuesday we am the report akoma no say cat labs no kolebu eduha konfanochi eduha tamale eduha ne niaji
wo so mana wankasa na wo
mi ana meko na baby ami ana meko na regional hospitals ni teaching hospitals ni me ni team na koy me nya doctor ba ko a wa bimpa na why me right hand na me left
because obi the way we see kasa no me to say I don't medical doctor
me teacher of you.
Wow.
I have a medical doctor attached to me, a friend Dr. Nobet Kipu. Yeah, Fanifi Tamale teaching hospital. He's a very young man, very intelligent and up to the beat.
And one guy's also the fast learner.
Yeah.
Because
kana meti hodia na me peke me wo operations directors wo ho me staff very very hard working staff. Ya ka say na ye tahama but 1 year obi abetansi nobody will complain. What me say nti omoma ejuma no e contempt obi aso nim ne de obeye sebe national health insurance staff na ye second year omo buy omo buy na ejuma no ma ye bi da national health insurance. It is easy for them to apply it here. Nti e ma ye mbre. What man say oba me communications thing said Kwame Boateng any Mrs. Sewa Ofe omo no omo da no fantastic guys nti ema media na say fatu ha fa ye say boy na ye ko na de bia so ye ko amena me de anim nti say me ko na wo be de akasa wo nti enya ye beko be bia ni ho a wo krom ha ye nko ye chi across the country within the 6 months we have done a lot.
The way we are so passionate about ejumeya wo ye ade na the next 2 years 3 years opese wo hu
me pese me hu se nkrofo mboka nkwa abrochi se yekosa ye ho yare aba pese nkrofo to me sorry no mo bora into the facilities no omutimi koji omu treatment itimi tuaka no mo kofi and that will be a legacy that I want to live at the Ghana Medical Trust Fund. That Ghana Medical Trust Fund buy into and the hospital equipment be a wohwehwe no ubenya dia ye treatment na wo asoma ye den adwo so that we can cut this me kwa abrochi akosa me ho yare aba and na mumbu mi hia dollars nya denya and there will be ba ho so obeji sika kwa abrochi in 2 years time na ubeka say the Ghana Medical Trust Fund into equipment be a hia for treatment ni bi ye den ebiwa and that's the story that we want to by the end of President Mahama term na will be in 2028. This will be his best and most fulfilled legacy.
within this 6 months, you know, a dear and a course a pilot, and more you feel so fulfilled.
The lives we have saved.
Oh.
The lives we have saved. Yesterday, there's a gentleman, man called Urake, called Rebecca surgery, and ran a bush and Fonia Fiapa West region, a medical trust fund. Na lo hwe letter much and I'm a die papa then come here later ba and see I'm fulfilled when I see people show gratitude to His Excellency the President and to the fund and to the people of Ghana because this intervention has saved their lives. Yentimi nkasa so ayenda tax force for na omutro yes ade we hu ejuma they call Parliament for it to be passed. I want to say thank you to Professor Aite. And any team, they've done a fantastic job. We share acting, what forward looking. I drink a cool mama or who say treatment will be here, equipment, treatment will be here, research, treatment will be here, infrastructure, be captured.
Yeah.
They did a fantastic job. Me kwa meja ba kwa ma in your own quiet time. Aye hwemu na hwe. Wo be hu se enye bibi a ya type keke ayede akọ. Eye bibi a hu sa adwendwen papa. Learned brains na komu no matro. Nti we nya ndc MPP we ye wo eye me eye nya.
Oh, the way Madam Obobi akasa no me to me when they say interview na I am Kobobo because what take you time and what take us through. Mema wakoba me pese ashefo mo hwe no mo san say afa no bi adjoin ya na nipa na sorry pekope nke wie ya was no kokolebu was a medical trust fund say mutu say take us through the the process so be area hinfa and one starting free hinfa and san ababe drew
okay, it's in a din kind of say, and one who say, yes, ye 12 bill, yeah, 50 pilot cases in a year. I know there by end of February, yeah, pilot cases. We are, and they say it's a month of love. So we decided to do it for the people of Ghana. Until by end of this month, in a year, pilot cases, pilot cases in a year, your software now, they connected through the facilities, and no, major. Yes, because we want to roll out from the 1st of April. 1st of April, we are rolling out with at least 30 facilities. 30 facilities, 10 regional hospitals and 5 teaching hospitals with about 6 district hospitals or more be qualified to be regional hospitals because at the end of the day in EBSI areas one regional hospitals in Niho. In that will be about 21. Now the private quasi for no I the account into 30 facilities. So we ubia your friend is saying dialysis, cardiovascular disease, then so starting making sure say doctor no or regional hospital or teaching hospital and or private hospitals here mapoboy because omuna ye be de ye ne omo be ye djuma nti se wonya ate se ye roll out from the 1st of April na call doctor me ayi de sisi ade me ho kire me kakranti mate se trust fund na banti wo betime de me atoso ana doctor no hwe wo nko no betime aye sa intervention ama wontimi nante mba me office ana wontimi send me obo a message say me tie me ya yes me kidneys were problem nti fameto so that be but doctor no hwe wo no ono no be intervention no amount because the softwares will be up and running into or board no the medical records in ya to so amaye ebebe bedi yen ye ho edi yen ho a ye wo up to 14 days it can be 2 days 3 days yetimi review na se wo pass ya approve then we alert the facility that from now going this person is under us into we test we be we treatment ye wo medicines list so aye de beba into se wo kona ye ma prescription we betimi age prescription drugs no e wo pharmacy or in our name. Yes ye betua ninya amount facilities ni we are every month no mo de omo bill be dey abrain na yeah yeti omoka.
Wow, we dear nyame nshamo pa nyame nshamo said ye can say the area ne ba yes say wo so any particles any men this any men pp ni cpp nti yesre na sa process so ye procedure na ye so e just say na you hwe na unim wo madam number nti na wa frɛ no wo frɛ na we say me yare nti mo mfa me nto so ye go through the process and what my dear we say so in the way ade e beboa pa e beboa ma omanfo dodo na omunim wo status and also omunim wo condition be bia edru no ko ye besa ye hu
exactly
go say kwa yare sabia
na obi so wo ho Sebi okopo na yesi nenufu na ebibia onim se treatment ne diagnosis ne niema no boy de nti onya akoya yesi o nufu no atochima na wakada sorry dem nti ebe kebe sa situations nya because onim se okono okoye ne mammogram ne ade na e free because Ghana Medical Trust and be betu amanu nti
na problem so ho so a ombe so
na ebe encouraging crofo bebre so omo take advantage na omo nko hospital.
Oh, nyame sham. Na said na we see eda manfo ase no. Abusiafo the way madam obo bi eda manfo ase no. Amanfo bi no so posa wo monsema shema no. Se men danase.
Hey.
But so no masana. Wo se men kancho se nyame sham. Oda wase papa. Oye me mate o. Our game pa me na ye masters together. I mean, wonderful lady. Na the way I will see kan wasem no wo ho so wo jana so wonka so betimi akasa wana mo nje wodimbo o si nya me
asa na se me nsa ba ko ne me nan ba ko me do office wo no ni ho me twa me ni antwa
wo so wo
me aso me ndi ne ho agro
nya me shirawo enyo ono nko but so nim NEIP boss where KJ me so one
your friend Eric da ko poku the same name na ma no
oyiwa o kan wasam sa o sinya me nshirawo oda wase papa na me obi ankofo me nim wo mu nim obi ade obi eni wono ma onka wo ho asempa yesi ni pa obi kan wo chi asempa wonte nyame nkoso nshirawo akoma pa ekita woni mina misi mina kan wasem say ya mina kwant misi o kan mina ye me mate secondary school.
Oh, I see.
Mina kan wasem say o say osabana the baby obi hia me ma ne mini bia da na sema me nyame hia wo
me hia no me tin ka cha o so hwehwe me kaka
nyame hia wo pa enti ye di si ase bia wo anu di se
na minim se bia wo benya messages bia na bibi na
messages in there basobo de yabo
eh sa e dey asem and ye nja wo na me feel say bia obi be wo questions bia na bibi
and ye sha se na ke bia phone line like wa me se ko waso betete wo mo won
se Rollout no so amesamba
me pacho wo ba e be boa ye pa
na obi wo ho pese oboa yen ye momo numbers na across the networks and *255#. Obi so wo ho se me wa manone e pese me ma musika and on the website no call live this weekend and no there's a button there that says donate into we click it so I know na wo screen so we click it so I ma one time donation and I bet me am a monthly donation whichever one you want no you just click it and go and I mean to me sorry I mean that corporate institutions be ase sabi ye ka say ye hwehwe sika no gold board boss Sami Jemfi baby obi anyamishra that crossfire say obi bra me call your money 2 million Ghana cedis.
Wow.
Yes. Ghana Gas MD Auntie Judith me do or say it's the end of the year and the corporate a year and then to the next year obebo my to equipment but this year embeji 300,000 na ye fan ko running trust fund banks First Atlantic Omini UMB me say you individuals abosumi bia omo je omo salary corporate CEOs so no omo dia koto fund in account.
Wow. I'm
telling you. And they don't want their names to be mentioned. Bosumi we January and February Flagstaff House staff ninya obia half of the salary came to us for 2 months no ya ti obia half at the Ghana Medical Trust Fund. President Nankasa ne 6 months salary at their account. Individuals are really helping, but we are asking for more. As Oliver Twist always says. Yes, omufa man ejuma no so ayeye no ebeso omo ani mo hu se enye so obi na ti bebi aje omo sikadi sika bia ayeje no ye account for and na ejuma no so ayede ye no mo nkasa omo ani tua se ye enu nti na ama ye social media platform no mindi hwangro what man say because information bia me pese ye de to ho na nkofo hu se ne ayeje ne ye de ye ejuma Dr. Victor Bampo Ghana National Health Insurance it's so am sorry me gina ho ye start here o se me was staff me de omba ma no mo abo out se wo be fa bi wa man staff owie ye dakro sorry anopa o se me staff no magege omunya contribution 800,000 wa be donate yes obi a ondwen ho se oye CEO so oye CEO wo beje odi odwen ho se adwuma na wo ye no hia mboa obi wo hot baby o se o me na me fa sika nkonkom obi ama mfa ngi ni din da bi me enye hwe ma me but epepoa the next person emma nyankopon be fa ho de ayeden israel it is not about me, it's not about President Mahama. It is about the lives that we will impact when we go out there to help people in need. It be a strong omoboy.
We me ya kasa producer ko man ya do see phone lines na to ni NBA entomo. Enti say wo hwe yesesi na enkomo aye di efa Ghana Medical Trust Fund ho. Eye madam Obobia e wo ha say wo pese ubisa na bibi ana se de ehya ase no bia wo hia clarification na wo hia mu nchi mu yie enti wo pese ubisa nso a ene e number no 030-225-7909 030-225-7909 ana se 020-377-7791 020-377-7791 we say ene ahomatofo edidi djuma mese wani die mu na no me education about yes wo frɛ mbie wo television set no volume no hu na wo frɛ me na wo tie wo ho ansa na wo ne makasa e ba say mani delay enti wo de adwum no kra anase dumo no na yen kasa emfa phone no menye ofrɛfo every amasaman me ba chote me nka good morning
madam
mbacho wudin
ase Femi Jones na amasaman
okay mbacho metie o
Pastor, Madam Bobby, I was not mentioning power.
Amen.
Not mentioning power. Minimum, but only burning many. Power.
Amen.
Motherfucker.
Okay.
That's
you mate. Me that's a power. Wash me so. Ubeti me a fresh CCA na wode wasem bisa a upese ubisa fa Ghana Medical Trust Fund. Onyama ye cheche mu nyina. Se wonti bibi ase a ubeti me a fresh na wabisa. Alex, Efremi Free Sunyani. Alex, good morning.
Blessed morning, Stabna.
Now, what to say?
Stabna, Patrona Kupanda, Patrona Tre.
Yamea Domi, so me your pa, Patromitio.
Stabna, Nakupa, on shell, no young kesse.
Amen.
And I put the men of medical friend, not miss. Good morning, Stabna. Nakupantum, Patrona, your pa, Patrona Montre. And I went na minister mononyam kese pa na me munguma mwiti more interest me say my husband a kidney patient.
Okay.
Yeah, na me ka say sinyane ha say no your dialysis machine be on all right, but you need infectious one to be ewo dia HIV hepatitis B need no no and no ni bani bi so be use separate machine. In the hospital, one of them, you need to be able to. In the no patient, they say they be a fucker free hands, and I have cooked matching 2 times in a week in a proper dialysis. Because maybe husband, they no hepatitis B. Here to me, father on the same machine as Nipa own needs a condition be all kidney problem.
Okay.
And the same thing so applies to the old the chimans, the old breakun, the old surrounded hanging. Nti kamia kwa yese ya ye was a problem na ye was nyan hanen ne san nyan ye ko hia mu ekumase ye private hospitals ne kwa ye that system e wo no nti we dey strengthening for so mu nya machines ni mi nu kwa na se ba ho kra ka ho teaching hospital ho no ka ho maya e betimi aboa ma wona wo sa condition na omo any other condition bi se HIV ni that bi no ye betimi aye no.
Okay.
And you bit my hand because I costly. They be the stress involved and they are fucker they be a cook master where that is 2 times the background. Stress is no company and the Santi area program. Okay. The best not to stop, but himself be has a dark one say I win among why. Among the back when I be no pay a medicine hospital on. Not the chimay. Kumuli ya feel cook master so enter my na that your man penny akuma say obebua sa ya ye water condition ya say what
Matty
yes we could do from why anofai
actually that's a
him say
madam Obobi ade asama
him say Andra na papa bi aminim no o ka chem so dialysis machines 5 bi o person de bre o donate ma trust fund ti mama na me say opie wo me dai
any we pie any o say
it's kind of kind of come to the why ombo mpa say papa dem fambra or the bar me ebe kai omo na yedi but me ankasa me medical director and bekasa immediately I am done na maybe san what we can do about it because that is really serious. Yeah. It is nyame yen adom so na yenya sa donation next week na you be make sure say yedi bi we call why na wakuma to yem na sunyane to Kumasi twice a week there ebi wom I na make sure we start here we cross go we be we no na wo hu nyama nya nyame wo ho Mr.
Abba Free Free Cape Coast. Good morning, Abba.
Yeah, good morning.
Now what to say? Yes, dear.
Hello.
Hello, Abba meet you.
Dear, I started here. Then you may ask the past, Bibi sister, Abba. You may aka Abba no na kuma say, boy. Na, yes, no. Bibi say no. Everything say a big ban no more, you know, politics. Now a big mood is that is a year me phone corner to be young more, a very boy. But Anka answer say a banister, but Minister President Mama, the only yes, and I am my me, send your word on yes, sir. If you are only 10 years away, I'll best start here, whatever call, and answer we say. And think I'm one no shano.
Amen.
No, on a young man, only been so. On come because if you are saying I young when I use yari be any a galante, no, I may be any DNA and your my ye na bata. If you are a young woodia, young, it is a bit say about dear. Yet then you say, or man, I give papa, president or Guinea pound. Any mammy or Guinea pound. And one no shrano.
Amen.
No boy, and my young. A young na, been so a warrior, real winning a real. I see it's your young one at you. When you read that winning any area here. Now, when I'm no, Yami Wabefa be a seda, John Kayamamia Kuma.
Amen.
No, we are mobile.
Yo.
No more fast, so not want you. Upia and my
okay. Yes, yeah, that's a pa.
Hospital one there. I bet they say you're very political.
No, can say I make because about assassin, but the way we see explaining here, and measures are more taking process near the no. There's no way say
doctor no about baby say party card we here and na when what's man say because doctor no only other joy what in name na brea or recommend say on board into our fund no o baby say for NDC card bra na MPP card bra into e ban this level no dia me dey me say munja politics into dining echi na yenye adwuma because nipa bia nkwa ho hia
okay Regina Free Asankregwa. Good morning. Hello. Good morning.
Pacho, good morning.
Now what to say?
Yamina dom na one to.
Yamia dom me ho ye pa.
Pacho, we be said. Morning. Hello. Good morning. Yamina dom.
Yo, ebusia for menyo frefo fremi fin koko. Pacho Timenka, good morning.
Fine morning, no papa.
Pacho Widin.
Pacho fremi UTC that make us fin koko.
Okay, Pacho meet you.
Pacho Madam Obobia na me campaign man wo wejao. Hello.
Meet you, Yusuf.
Na me person ka me fa akonya with one. Na me di adisadi mi sure ni nanka wutimi di ani akramai.
Sa I fa medical trust fund ho ana.
Fa medical ho but eno so hia wada wo.
No ye de hia Yusuf.
Me pa cho o say weja ye frɛ bronu bi away won. Ye frɛ bronu bi away.
Meet you, you save.
Mpacho weja e fre bronu bi away. Obapa. Obeje di say away ko kakaka nyina no. Public toilet in who nsuo na e ho no. E kwa no bi e twa no to nsuo no.
Ene de anyo na anu ya ye cheche nkrofo o. Mu amekwa ko jam na wo nsuo mu no. Ye cheche nkrofo. Even e poano ne ade ye cheche wo mu nti enya ade pa.
Obapa. Me se me campaign ma obo bia o weja. We do me say obetima die ni mu amadi this side.
You save.
Enye fine.
You save wate pa wate. Ene se yetimi enya eye MP a wo honom ene MC ni DC so wo honom na wo matu ho anamon. Okay, Seidu me last call I'll frame free at say good morning Seidu. Hello Seidu, good morning.
Morning Wahima.
Nampacho what to say?
Yankupa do monteme hoye.
Okay, mpacho metie o.
Okay, me de mechanic say ma menchia o na menchia o producers ne. Engineers and technicians ne we tie fo nyina.
Ejo so.
Wahima wo bo bia da ko so mechia no san chia wo.
Yo.
Eye in fact sa mama ke no eye ade papa. Se timi ye ni ya ebeboa me de pa ho mopo. Me de mesre kura say mu te say wo de metashe wa wo so mema no na wo so omkot. Yeah, ambassador no be. Na mo lobby nanka ayiga machines no so man lobby because I was say munya ayi akade no tache bi kura mo betimi abua machines na obai eyeye na Ghana ayi yeso enkrofo mo approach ni na akoduru wo mo ne lobby say de be ya enyoma na akade no na ya maintenance ayi no so no ya hwe ni ye say de be ya program no enkoduru baby a ebebu akem we ne me madwen kakra me de be ya yi na
Seidu
Ghana ebebu duru baby a ebehu omboko wakasa nyampo kamo
amen
no mamutumaye
amen udika mema no mo ba me appeal to wo mo no mo nyina so akudonate e de atomo we say eye odokwan so ye nyina ye nyi bi mfamboa nti ha say ne de offer for no say ye bi a phone license won go for e ja to one na nti this is the time I see ye nyina prince of bim pemi producer mpacho yibima ye nyina ene ye be weti na wo no
me here asem so betu wenim ye papa despite any easily gone executive club any
mpacho mo fa madam obobia no on making the appeal ye wi ye twa honom na say ya broadcast here no ene me boss
me there ya this ready kese to your papa despite any easily gone executive members ninya enim ye pese ye shiom na ye presentation mom ye mom hu ne ekoso wo ye various facilities e wokrum ha any niema say yetimi ye intervention as a country enye ni nya na ban betimi aye but omo as individuals no betimi come together no ma ka chen mpo say bia Rich Hospital ye to equipment ba kwan den esi ho ebebo wan minim say nye omo mpenimfo no kwa minim say omo youth dey so wo ho Kennedy da no nti me ye appeal so ama Kennedy ne nkrofo a one omo ye sa no ye friends and group no ye sromo we just want to make a presentation to them no more understanding what the situation is when you go into facilities your friend regional and teaching hospitals in this country. Omo ankasa ye presentation ni wia ye nka bi nka ho omo abehu ne omo be ye nti anape ye wo ha na de ya share de kese ena to ye papa Kwame despite anymore.
I was there for it na Mrs. Apenyina sebo de aso na di here dia wo de aso eja no is it Yidan or Yidana Frank Osman on the say memfa or say godmother name na say we say bold you know say greet or say me extending the greetings to my godmother Ajua Obubia Okuda ko na me name da say enu ti na mama
we to as here we do chese oni me pa
papa dey account no net so cheche mo ka sesa initiative wey brilliant and kanka wo mo ni edi da so kai sa ya re kese we say e be ba be je wo mo enkwane no na sa eye mahama case no e wo ho no man wo sre se obi bia so fa ne ho enjim na yintimi emboa se de be ya Oma wo ni bi nso so no wo mo ho betimi ato mo free sa ya we ho tini na ye fa fidi kesi so asede edi kan no free asana ho se nyame nhyiraw na
Mr. Daku
Eric Mr.
Daku Eric hey
oda wasepa
me aso me danasio anaju ewia ahomachi Eric nie yayira koku nie aba me from omobaba sesia
yo nti yenso so ye bi fa fidi kesi so ada wasepa se ene isa sempase woni Ghana man na aba becha manni eni da so aba ma wo ni bi ti ne obi wo cancer onya hotoso senka kanka ene yare na aka ni nyina na ekọ enimo no na mo so mo baba bi
shi tika che sunyane fo nso mo akoma nto mo yem health tech papa na promise me say obebre me dialysis machines na dia mom eno ye do mo sunyane teaching hospital e be catch them say we is for the infectious for their dialysis nti ye de be call in your name
asam na can say intimidasi ebedasi na paper
so me da was senya wo ye adwuma no mane so ene no nyame nhira o ma ahoden na de bia nya ahoden beta ha na ye ne pepepe you are so beautiful and then you look good on the screens nti ye hu ukra na ye ra ho na ye ni age nti nyame nhira why oh, you are too beautiful.
Oh, thank you so much.
And keep doing it. And you see, I always say that there's a difference with being beautiful and there's also a difference with being...
polish word no.
Polish word. You know, obi wa no of buttons onye open, onye exciting. But I think that you have everything. Nyame sha na fa ye adwuma na fa bo a wo man.
Thank you. Thank you so much. Oh, is it all for me? You're myself for Madam Bobi Adako Poku Administrator Ghana Medical Trust Fund. I need name say friend of Mahama Case and ne yanene twetwem komo impune mpuso. Ya dai ho ya koba dietitian 1 e de ba be fa pomudin gita ho demo. Enko ba bia be ba sesia.
Against you will prosper.